We all have a dream to learn from the central institutes. 1 lakh plus salary, no bond, learning from the best of faculties, and branded college names. So, why are toppers leaving central institutes like AIMS Delhi, PGI Chandigarh, JIPMER, MAMC, VMMC, and many more? So recently I came across a video and thought about making this video because I had also left MAMC, but my situation was different. I didn't have to lose a year or lose any month also. So let's watch this video.
Hi guys, I am Kamal Singh Shekhawat. I secured an All India rank 10 in this recent INICET exam, November 2024. I was doing my MD medicine course at PGI. I was in third sem, and then I decided to quit finally today for all the official purposes. I submitted my resignation to the dean.
So he was in third sem. He crossed approximately 1 year.
Resignation to the dean and registrar, and I took back my original documents, and I'm coming straight from Chandigarh to my hometown. I wanted to share all these things with you guys. A few of my friends suggested me that everybody's doing this, so why not come up on a social media platform and share all these things with you? Maybe you would want to do something like that, and there are challenges obviously on the path, and I'll be sharing with you all the problems and challenges I faced and how I tackled them, and all the insecurities I faced during the time when I left my residency and I was literally back to zero when I had to prepare again for INI after being off to studies for 1.5 years. So it was not an easy decision for me. It was literally the toughest decision of my life so far, and I cannot say it with easier words than that.
There are many toppers like him who leave the central institutes, but they fail to express. I am giving you some examples of people I know. There was one guy who got into MD medicine AIMS Delhi and he left in the INI November. He took PGI radiology. There was one friend of mine who left AIMS Delhi MD medicine, and this year through NEET PG he is going to pursue dermatology from State College. There was another guy who changed his institute about 3 to 4 times. There was another friend of mine who left Chipmer respiratory medicine and took MD medicine in a peripheral government college of West Bengal. And this and surprisingly, these incidents mostly happen with men only. Means personally, those whom I know, they are mostly men. Maybe that is also a factor. When I would discuss about that also. So you can understand that many people leave these central institutes, but they don't speak a word against them because there could be an associated hate with that. Now, why I had left MAMC due to my personal reasons, I had shared you on the internet and it is available. And it was not toxicity, it was not anything else. It was the hectic duty hours and my personal life situations that I had faced. So let's dive into the reasons why toppers are leaving the central institutes. And if you are new to my channel, do consider subscribing because like this kind of video, you won't get anywhere else. Coming to the first point, that is the central institutes have much more hectic duty hours compared to the state medical colleges. Like when I was in MAMC, it was also having an working hour of 110 hours per week in dermatology residency. And in the central institutes, you don't get help of the interns. Okay, the interns are not there to help you, but in the state medical colleges, generally the interns are available to do the blood sampling and all, or tracing the reports, and they help you much in your work. So for me in dermatology residency, I was going for a work life balance. approximately 70 to 80 hours was okay, but 110 hours was a bit excess. Means I wanted work life balance during even my first year of residency. But when I left my dermatology, then there was a seat vacant for radiology, but I didn't go for that. It was having very less duty hours, approximately 60 to 70 hours per week. But I didn't opt for that because for me, subject was more than that of institute. And for every one of you, that should be the point. Subject always comes before the institute. The second point is the less hands on. In central colleges, you get less hands on, and that is practical also because the faculties are there for more number of hours because they can't do their private chamber practice. And in the central colleges there is 3 years of SRship, so the main hands-on training is focused towards the SRs, and you are more or less given the clerical work or doing follow-up of patients. See, all these points after this are generalized and they vary from person to person. So, the third point is that toppers prefer mental work more than the physical work. In the central institutes, as you know, the duty hours are more, so the physical work is also more. And to be blunt, toppers don't like that much of physical work in general. Some may like that, okay, and they want to do more of mental work, more of studies, so they can't focus on studies during their first year of residency also. So maybe this could be also the reason. In the central colleges, you are in the top college of the country, but you don't get that bossy feeling because there are, as I said, 3 years of SR and faculties. Everything and anything you have to do, you have to ask the faculties. If they give permission, then only you can proceed with the treatment. But in state colleges, what you have that you are your own boss. You take advices from the faculties, but in some cases you can decide that what treatment you are wanting to give the patient. It's in your hand. So you have the feeling that I am the boss, I am the boss of myself. And in the book of psychology of money also says that you would like a job till you feel that you are commanding your job, not your job is commanding you. Now, coming to the point that why my acquaintance who left the top central institutes are all men, not any woman. So, this is my personal view that I think women have more adjustment capabilities compared to the men, because in Indian society we know that after marriage women have to adjust many things with that of their in-laws. So compared to that, the residency is nothing, I feel. So women have the inborn tendency to adjust, I feel, in the Indian setting at least. So I feel that might be the reason that why only men are leaving the top central institutes, but women are adjusting to the environment. Sometimes there are other causes also, like that of toxicity that could happen in any college, not any particular institute. Apart from that is the cultural barrier that they face, the region and the language barrier. Sometimes there are few other personal reasons also, like I also had. So they also drive as a factor for leaving a central institute. Thus, the main advice I can give you through this video is that your mental health is more important, your physical health is more important. It is not just the money. The wealth consists of your external wealth, your physical well being, and your mental well being. If these three all are satisfied in the environment you are working, then you should continue the work, or else don't hesitate to leave it. Okay, your satisfaction in life, the mental well-being and satisfaction is the main factor. What people say is the outward success, it is not actually the success. Success is staying happy, being happy. Now, have that all said, only hardly 5 to 10% people only leave their seat, hardly 5% from the top central colleges. So this is not the whole picture that if you take admission into a central college, then you are going to leave. There are very less and rare chances, and it is not at all advisable to leave a central institute if you are not facing that much of problem. Those who are going to take admission through this NEET PG and INICET into the central institute, you shouldn't reconsider your decision of choosing that institute by seeing this video. Okay, never give a second thought to central institutes because these are the top colleges of the country. You would get the brand value, the high stipend, and also the exposure to the best. Thus, I hope I am able to explain what is the reason that few toppers are leaving the central colleges and going for other institutes and preferring a less hectic stream. So if you are new to my channel, do consider subscribing, and you can see two new videos popping up. One of them is on why I left Maulana Azad Medical College. So take care, stay safe, and all the best.